Hello and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin, and I'm very excited to have a great guest with me today, Cissy Mangrum, who's from Specialty Dental Brands, an influencer and speaker with over 20 years of experience growing medical and dental practices to achieve operational revenue success. Cissy values and focuses on team members' growth, leadership, and operational efficiencies. Cissy, thank you so much for being on the Patient First Podcast.
Thank you, Dr. Bryan. I appreciate being here.
Yeah, it's great. I mean, I'm intrigued and excited to talk to you today on the podcast. You come from sort of the world of medical, which a lot of people who work in larger organizations, it seems, are coming from the world of medical into the world of dental. And so you've kind of been on the other side of the wall, so to speak. You know, what are you seeing? What are you seeing within dentistry, and how does it differ?
One of the biggest things is this is just it's ultimately just growing. And there's a lot of colleagues of mine that are seeing the growth and want to be a part of growing with you guys. In the dentist, it's amazing. The biggest thing that I see for me is it's just a whole new world. And it's just an amazing world for me because the tempo is different, the people are different, the doctors are different, and it's just amazing to be in this aspect of it. And then also with all the technology that's changing and all of the vendors that are getting involved and getting in making it better for our dentists and our operations like myself and revenue cycle like myself, it's super exciting to be a part of like almost the groundbreaking aspect of this amazing technology that's coming. So yeah, that's what's really cool about being it, because, in the medical field, you kind of hop in right when it's happening, but you don't really know because you're young. I was young when all that stuff was happening. And now being a little bit older, I'm getting to, do that again. And it's super exciting to be a part of.
So I hear you saying that dentistry is behind medicine a little bit. And so you've kind of like ridden a
a little
wave
bit.
within medicine that we're kind of rewrite doing the same wave in dentistry. Do you agree with that?
I absolutely do. When I came into the medical field, that's when EMRs were just getting started and everything was starting to go electronic. And so we were switching from paper to electronic. And then there was a lot of the vendors, a lot of different vendors getting involved and a lot of integrations happening, a lot of interoperabilities happening, things that are saying, hey, how do we make this better? And that was like the first part of my career, the first 10 years of my career is, being a part of that. And all of that coming together is an amazing thing to see because it took such a long time. And now coming over into the dental world, it's like we're doing it over, but it's at an excelled rate because a lot of these vendors that are coming into dental, as you know, have that background in medical as well. So they've done it. And so now they're like, hey, we know how to do this. And us that are operators that come from medical, we're like, hey, we need better systems, better processors, better things, and they need to talk to each other. So I think that's also pushing the technology to go a bit faster. So we're seeing it, in my opinion, from what I'm seeing, we're seeing it faster than when I did it back in, the early 2000s. So it's really an interesting thing to be a part of. Hopefully we have learned our lessons from back then and are going to make it better this round.
Well, I think that's a big part of my mission. It's part of my book, part of what we're doing at Toothapps, trying to, I believe this is kind of I'll make the statement of what I believe in, then you can either confirm or deny it. That we're on the precipice of the biggest wave of innovation and elevation of patient care and dentistry through unlocking what you mentioned, interoperability. The actually having the systems are there. We have the technology. It's like kind of like the $6 million man. Now I'm totally dating myself. Like we have the technology. We just need to connect it, right? We just need to connect the systems together. Yeah. And the good news is in dentistry is that nobody's done anything. So we've tried to create a system that's more holistic from learning from our medical colleagues who kind of paved the way and are still kind of like
Yeah.
trying to correct the errors of the initial wave of interoperability.
Oh,
But
yeah. Hmm.
now that we have that within dentistry, I it better not take 10 years for us for us to get to right. I
Oh,
think it'll
I'm
probably
gonna
take
tell you, it's
two.
gonna go. Yeah, it's gonna go so fast for the dentist in the dental industry because there's so much that was learned, right? There's so much the knowledge and the AI, the different vendors, the different people. There's just you have so much more. I mean, they were breaking the ground, if that makes sense, right? And so we get to take advantage of all of that. So it's pretty exciting. As an operator, it's super exciting because you want to be able to interact and connect. Like one of the things that we saw that was super amazing in the medical field was the P2P, right? The provider to provider or doctor to doctor, right? And seeing that coming into the dental world is pretty amazing because, there's just something about having that instant connection with a doctor if you need it. And so that interoperability among platforms, as we see that interchange, it's going to be pretty amazing for our doctors for referrals, for patient interaction. You have a patient that comes in and is like, I don't know when my last checkup was with doctor so and so. And, having that interoperability and a doctor saying, oh, no problem, I'll reach out to, Dr. Smith and get it. And then bam, you're getting it. And that's what's amazing about having those interconnections with the software. And then, of course, for me, as a revenue cycle leader, it's super important to have interacting, connecting of information, making sure that we have vendors that are able to connect with our PM systems and being able to communicate with patients on on that more electronic aspect. And so, yeah, it's going to be, when you talk about it happening in dental, I don't think it's going to take more than 5 years. It might take 2 or 3. I agree with you 100% when it comes to
Yeah, I'm pushing for two myself. I like that. That's great. It's funny that you mentioned because we actually are launching our referral system within the next by by the end of this month. So probably by the time that this podcast goes live, and then we have a patient application, so patients will actually have access to their electronic dental records by the end of this year, which I'm super excited about. But like you said, it's
yeah.
in my mind, this is about like getting all of the great innovative companies connected and together. When you're talking about provider to provider P2P, that's the first time I've heard. As a dentist, that's the first time I've heard it called P2P. But P2P, I feel like if you might if you're referring from a general dentist to an oral surgeon, and you circle a tooth that needs to be extracted, that's like sending a text message to your best friend on their birthday. You know what I mean? It's like it's just not enough. You're not doing enough, right? Let's get the whole information and connect like the professionals that we are, right?
Yeah. I think with my experience with like doctor to doctor P2P, if that's a new phrase that you've ever heard, my experience is that for a patient, like myself, there is just a value of knowing that you can connect with the doctor and get something that I have forgotten or I'm not remembering or and there's a value like as a doctor to reach out to an oral surgeon and say, hey, I've got this, and this, and they respond back with even more detail than you had in the past, right? And having that the ability to do that is amazing. And it really changed the way in the medical field, really changed the way the doctors interacted with each other. Instead of it taking several weeks to get a referral letter back saying, thank you for referring the patient and we saw the patient and this is the things that we did. That P2P connection was happening almost after the doctor finished signing the doctor's note and it was going and it was in the next chart for that next doctor. And I think that's going to be amazing in the dentistry world when that happens, when that comes together and it comes, and things. And for me, as a revenue cycle leader, I like making sure things are getting done and communication is getting completed. And so when you're able to have those connections it makes a world of difference.
Well, I mean, I heard this statistic that only 38% of dental patients see the referrer that they're referred to. 38%.
Mm.
So in that case, there's not a lot of revenue to manage, right? So, I
Hmm.
mean,
Hmm.
I think all revenue at its basic core starts with communication, right? So we need to connect
Oh,
and
absolutely.
information, right? And so that's great. Well, tell me a little bit more about specialty dental brands. Like what who are you as an organization?
So we're a pretty fast growing DSO or DPO, how you want to describe us. Our partner doctors are part of our group. We have a little over 250 locations across 26 states. We have orthodontists, we have OMS doctors and P's. So we specialize in taking care of the patient from the time that they're a baby all the way up to, oral surgery if they need it. And super excited to be a part of this organization. Super, the growth, the doctors are amazing, the teams here are amazing, and we have some pretty innovative individuals here that are, all of us are looking at what's the best thing to do for the doctors and what's the best technology to use, and what can we do to make it easier, because that's the goal, is to make it easier on our doctors and our teams and our practices and our locations, right? We don't want to make things harder. So that's our goal, is to do those things. Just an amazing group of people here at SBD.
Oh, that's great. So, what are you most excited about? Like when, because you're excited coming from medicine, seeing all the sort of potential on the dental side. What are you personally most excited about?
Well, I'm a little biased to revenue cycle, right? Because that's what I do. But I am super excited about the technologies that are coming out, like the different platforms and vendors that we're, looking at and seeing. We work with quite a few vendors, and I I think that what I'm seeing is that they're willing and able to make changes, and they are taking our expertise and saying, hey, can we utilize what and build these platforms so that we can make it better. And I love that, because I think it's amazing that they're willing to open up their APIs. They're willing to open up their platforms for us to say, can you change this? Can you add this? Can you do this? I think some of the things that makes it really hard in dental, for example, is the interactions with the payers. And so I think, I can be completely wrong, but I think our payers are starting to see or starting to hear that we need more electronic interactions with the payers. And one of the things that I'm super excited about is we have a credentialing platform that's 100%, electronic. And we're talking with our payers right now to say, we want to interact with you electronically. We don't want to be sending spreadsheets. We don't want to be sending paper to you or faxing things or emailing you. We would like to just send things to you via API or, a connection of some sort. And the payers that we're talking to have been like, really now? And we're, kind of showing them these things that we're doing. And of course they have, there's delegated credentialing, right? But we really want it to be so easy that they get our roster like this instead of waiting, or we get response from them super quick. So all of that to say is, I think we're just on the cusp of making some amazing changes in dental that's going to be uh, life changing for SDB and our providers. But I think it can also be for the dental world as well, as they start opening up, the payers start opening up these abilities to interact electronically. I think we're just at the cusp, but you feel that pain right before, right? That pain right before the open happens. And so that's kind of what I'm excited about. But I think it's going to be coming very, very soon.
Oh, that's great. Yeah, I agree with you. I talk to a lot of payers, and I don't think that they're as anti-innovation as most people think. I don't think they want to pay anything, but they don't. But they don't.
Well, that's a whole
that's
nother podcast. We can talk about
yeah,
that later.
yeah. That's a chapter in my new book. But I think the I agree with you. The idea that they don't actually want to speed things up is not the case. That is not true. That they actually do. They do want to speed everything up in dentistry. There's just, obviously, like you're saying, we're taking our sweet time getting there, right?
Yeah, yeah.
I've
Hmm.
been
Hmm.
I've been hearing we're getting to the topic of paying for dentistry. There's been a lot of highlighting of a it's not a news study, but I've seen it refocused on that the amount that people view, like how patients view dentistry as expensive.
Yes.
This is a little bit leading from me because of how I view this, coming from the medical world, right? What's your perspective on the cost of dental treatment?
You know what? It's different, right? Because you can't connect, for example, I work in heart and vascular. If I told you the price of what it costs to, get a cabbage done, which is, getting bypass, right? It's thousands and thousands and thousands of dollars. I mean, at the end of the day, the cost of dentistry is, I don't think it's outside, it's not outside what is you would think a doctor should pay for the services that a doctor should bill for the services that they provide, right? So I think it's super important that our doctors understand their value and understand that the service and time that they put in, the schooling, the education, the residency, all of that came in to play. And you want to make sure that you're charging the amount that you deserve, and also that it equates to the quality of care that you're providing, correct? So I think everybody is different when it comes to the charges, right? Some people want to do much lower charges, some people want to do much higher charges. I think it's really about what your market is, which amount your market is doing. But I also think it's about looking at what your services are. So compared to medical, I would say that if we were just taking a pediatrician, for example, with a pediatric doctor, right? I think the charges are right in line with what you're doing. So if, for the different things that you offer, right? And yeah, the problem, I think the biggest area that we say in medical and dental is medical is an insurance company that pays for most of all your services, right? And you pay a deductible and a copay, right? At the end of the day, you're going to pay a max benefit of X, right? You're at the end of the day out of pocket, right? Whatever that is for your medical insurance. So it could be max out of pocket is $6,000, right? In dental, it's different. The insurance is different. The insurance is we're going to pay a max of $1,500 or $2,500, whatever it may be, and then everything else after that is then patient's responsibility. So I think that's where people get confused as to why they think dental is more expensive. It's just a different type of coverage when it comes to dental processes. And then at that point, I think the dental industry as well as the community of dental, you guys offer great, incentives and great things for patients so that they can have the dental care. So whereas medical, they're a little slower on those things of offering different platforms or different things for the patients. So I think it's just a mix of how you look at it.
Yeah, and I mean, I kind of where I come in is that I feel that you're kind of a very similar with you. How dentistry is paid for is very different than how medical is paid for in many
Hmm.
cases.
Hmm.
And if we were to take apples to oranges, so to speak, and look at them, the charges in dentistry are drastically lower than the charges for a
Oh
similar
yeah.
procedure on the medical world. And I think that it's kind of on us as an industry to sort of like value what we do to the
Hmm.
point because price is a function of value, right? And if the value's
Hmm.
there, then it's inexpensive versus if we don't think the value is there. Yeah,
Yeah.
I well, you have a wealth of knowledge in operational inefficiency. If you were to talk to the average dental practice or the average group and say, I think this is more than likely the one area that you could increase efficiency in your organization the most, what would it be?
Wow, that's a good one because it's the most simplest thing a practice can do, and that is verification of benefits. I think that is, I know it's cliche and a lot of people will go, oh, sissy, but it's true. If your verification of benefits and insurance is done timely and you have it as close to correct as you can, because you know you have to deal with getting information from the payers, right? But if you're able to do that and get it to the patient, your odds of collecting your money up front before services are rendered or after services are rendered are much higher. And you will have an ability to be much more efficient at the end of the day with making sure your revenue is getting there. Your patients understand what's happening, they understand the cost. What I see the most, just from talking to people, talking to other practices, talking to other people like myself and the other DSOs, is at the end of the day, all of us are saying the same thing. Verification of benefits starts the whole process. And if we don't get that there, then we just are just missing the boat. The practice is missing, the patient gets frustrated. It's a lot of that stuff. So yeah, it's super simple, but super, super important.
Well, great. Well, Cissy, thank you so much for being on the podcast. Where can people go to
Yeah.
find out more information?
More information about STD, you can go online and look up specialtydentalbrands.com, and you can learn more about our organization and what we offer to our patients and our doctors. And we would love to hear from you. And that's more there. If you want to reach out to me, you can reach out to me directly at my email, which is Cissy Mangrum. I'm at cissy.mangrum@stdmail.com. Otherwise, you just reach out that way.
Well, thank you very much. Appreciate it. And thanks again for being on the
Yeah.
podcast.
Thank you so much. I appreciate being here as well.